After diagnosis of a chronic or life-threatening illness, it is normal and natural and very common to be faced with fear and stress. However, that can be really compounded when you're diagnosed with a relatively rare illness like vasculitis. And so at that point, there can be extra uncertainties that come up in contrast to very well understood illnesses. And for patients, when they're navigating their journey as a medical patient through these uncertainties, it is so important to learn appropriate skills for knowing when to act and when to wait. And it is very challenging becoming your own doctor to figure that out on your own. Now, connecting with a specialist is a great step, but for many, many patients, they don't always have access to a vasculitis specialist or rheumatologist on demand for answering their questions about when and how to follow up with their symptoms. So in lieu of that, stress management skills provide patients an opportunity to regain control in their life, deciding when and how they're going to follow up on their worries with behaviors that either help reduce the worry or potentially make it worse. For many patients, diagnosis with vasculitis may be the first time where they're thinking about stress management. And so it can be a turning point that is a wonderful opportunity for them to learn skills they can carry with them, not just for managing vasculitis, but other stressors in life. One of the most important things that we can do is, first and foremost, get in touch with a mental health care professional who can help reinforce skills that have worked well for you before in your life. Maybe there are parts of you that demonstrate fortitude or resiliency. There probably have been. And a good mental health care professional will remind you of those strengths when you need them the most. The other thing a good mental health care professional will do will expose you to evidence-based psychotherapy skills. These include cognitive behavioral therapy and increasingly what we call third wave CBT skills, which include mindfulness training, acceptance and commitment therapy, and mindfulness-based cognitive therapy approaches. A trained mental health care professional can guide patients through these skills and again, remind them of when they need to use them the most, for instance, before or after a medical appointment. I think the last thing I'll say is that for patients with vasculitis who are interested in getting in touch with a mental health care professional, I would encourage you to seek out an evidence-based psychotherapy. These include cognitive behavioral therapy and some mindfulness training. There are other types of psychotherapies that don't have as much research support. And for right now, for you in managing your stress, I want you to have access to what is evidence-based. So cognitive behavioral therapy and mindfulness-based therapies are the types of therapies that are most evidence-based at this point.